Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Nita Valens.
Hi there, Dr. Darrow.
Nita, how you doing?
Great. And yourself?
I'm living it up. How about you?
I'm living it up. And for our listeners to live it up, they have to call you and get their free book today at 866-870-5752. And we already have our first caller online.
No way.
You want to go talk to Sally?
Yeah, let me take a look here. Yeah. Sally, you're a former patient and you want to give a recommendation on your recovery. We'll take that. That's a good way to start the show. How are you this morning, Sally?
Oh, hi, Dr. Darrow. I'm fine, thank you.
Good. Are you living it up?
Yeah, I'm living it up. You're right. Well, I just wanted to... you've done such wonders for me, Dr. Darrow, and I just wanted your audience to know about it.
Oh, that's very touching. Thank you so much. I appreciate it. What happened to you? Tell us a story, because I don't remember everything.
Well, let me see. Let's start back in 2005. I tripped in a parking garage over one of those cement tire stops, and I tore my meniscus on my right knee.
Okay.
So I went to several doctors, surgeons, two doctors, and they both told me that I absolutely had to have surgery, and that was the only solution, or I would never walk again.
Whoa.
Well, I was really disturbed, and I had been listening to you for some time on the radio. My mom and I listened to you every Saturday. and so when I talked to my mom about it, she said, why don't you go talk to that man, Dr. Darrow, and see what he has to say. It can't hurt. Might as well find out.
Sure.
So I went to you, and I was just absolutely thrilled because you gave me treatment. What we called then was prolotherapy.
Oh, so that was a long time ago. How many years ago was that?
2005.
Okay.
And you treated me with a series of 3 shots. I think it was maybe 2 or 3 weeks between.
Yep.
And I was healed. I was completely healed.
Amazing.
And I went right back to climbing the mountains and doing all the activity I did before that, and it was great.
Well, congratulations. I'm glad it worked on you.
Yeah, I was so thrilled. And I have to just say a side thing. I ran into somebody who had been in therapy with me. I had been in therapy for 3 months.
In physical therapy?
Physical therapy,
yeah.
Right.
Okay.
And that person said, you're going to go and get shot? I said, yep, I'm going to do that. So I did it, and I ran into that person sometime later in an elevator, and he was on crutches again.
Oh, no.
I said, what happened to you? He said, well, the surgery didn't do so well, so I'm having to have another surgery.
Oh, my God.
I said, well, guess what? I don't, and I did Dr. Darrow. I was so thrilled. But then, again, more recently, in 2020, I fell again, and this time it was a really bad fall. I broke my femur several places, and I had to have major surgery. I had a rod put in down the femur, and then a screw to stop the rod from sliding into my knee. But I wasn't really aware until all that healed that I had also torn my meniscus on my left knee. So I went and had an MRI, and sure enough, it was their problem. So, of course, I came back to you, and this time you treated me the first time with shots. First shot, I should say. The first shot, it was stem cells and PRP is what we called it now.
Okay.
And then I think I've had 2 more shots of just PRP only, and I'm healed. So it's also wonderful, no surgery. let the body heal naturally.
Yeah.
Go to Dr. Darrow.
You're the perfect patient. May I comment a little bit, Sally?
Sure.
Because there's so many issues that come up that are amazing and will help us educate everybody listening to the radio show that you've just brought up. One of them is when you fell down the first time in 2005 and they found a torn meniscus. It's really important to know that meniscus tear may have been there for 20 years and never bothered you.
Oh.
Yeah.
Yes,
So,
I suppose it could, because I was very athletic, very involved in sports.
yeah. And as we age, many people get meniscal tears that don't even know about it, which we find when we're doing MRIs on people who say they have no pain. We do it as experiments. So a lot of people, So a lot of people will have an incident take place, and then they get an MRI, and then the doctor says, "Oh, look, you tore your meniscus, you tore your rotator cuff in your shoulder, you tore your labrum in your hip," but those may have just been there for years and years and never bothered you. So we need to know that these things that get operated on may not be what we call the pain generator. They may not be the thing that's causing the pain. And that means don't jump into a surgery just because you have those. And, I've been doing this work for, since the late 90s, and starting on myself from injuries I had. And I self-injected myself just experimenting because there were no classes or anything really back then. So I was a case of experimentation on myself, and I healed every time that I used it on myself. And as you probably know the story, my wrist was first, and that healed. That was from a golf injury hitting the ground. And then the next one was my shoulder from playing years of tennis. And I did have a surgery. I was in medical school and had a surgery because I was doing orthopedic surgery, and I had my boss or my professor do it for me. And it came out really bad. And I had a few years of very bad pain from the surgery. It was worse than just the injury itself. And then when I learned how to do this, I injected my own shoulder and it healed the next day. And then what else have I done? I did both my elbows, both my knees, the other shoulder, and other people have done my neck and back because I can't reach back there. So I've had really good luck with this. Not everybody has good luck with it though, Sally. I have to say that as a disclaimer. And I have everybody sign a consent, which you probably signed, that says no guarantees, because it's not magic. It just makes sense. It's stimulating tissue to grow in the body where it's been disrupted or worn down with arthritis or things like that. So it's been pretty much a miracle for me. It sounds like it has been for you too.
Oh, absolutely. And I tell everybody about it, and I think I've sent you a lot of people.
Thank you so much.
it seems so simple, but it's really the body's wonder.
It really is. And I mean, if you think about it,
can do something.
If you think about it, we injure ourselves very frequently, but it goes away. So the body knows how to heal itself. But some of these injuries, the body just can't heal. I've had people with 50 years of, let's say, low back pain, and they come in, and sometimes it's only one series of injections, just a bunch of injections in the low back and the ligaments, and they're healed. So, and then sometimes some people take a lot of injections. I know there was one time where I injured one of my shoulders, and it took me a few months to heal, and I wasn't going to get surgery. I mean, I knew if I went to a surgeon buddy that they'd tell me I needed to, but I knew I wasn't going to. So I just kept at it, and it finally healed, and I'm really good now. I'm actually in front of a camera right now, and I'm lifting up my arm, showing people that it's really good. And I'm planning on playing golf later today and doing some weightlifting. So my body's in pretty good shape. As I'm 73, I think you're probably about the same, right?
Yeah,
we're about the same.
1 year younger.
Yeah, you're just a baby.
A baby, yeah.
But as we age, the body dries out a little bit, and we get these aches and pains, even without actual injuries. Just walking around is a continuous injury, and people wear down a little bit. So a lot of people come in when it's too late, when they have what we call bone on bone, where they can't move the joint, and there's not a whole lot I can do for that. But they have to be careful that a lot of times they get, I'll say, crucified with the term bone on bone when they don't really have bone on bone. And I examine them after they tell me they've been to 3 doctors who said they have bone on bone, and I can move the joint around easily, and I just laugh and I go, you don't have bone on bone. You've got some cartilage loss, and it may look bad on an MRI or X-ray, but the exam is really good, and we can probably help you. So, and all of those people get a lot better pretty quickly. So, Sally, thank you so much for calling in. It's very brave of you.
You're welcome.
Yeah, and your story is
thrilled.
Yeah, your story is.
I just wanted to put one. Can I just tell you one more little thing?
Of course.
I sent somebody to you who had years, a major golfer, major.
Yeah.
And not a pro, but an amateur, but top. And he'd had years of injury on his shoulder, and years of steroid shots.
Yeah.
And I said, finally, why don't you go to see Dr. Darrow? And when he saw you, he said to him, you should have come here earlier because now you have, it's all disintegrated. Everything that I could use to heal you, it's no longer there. So he ended up having to have a whole shoulder replacement.
That's a good point for people to listen to. When we get cortisone injections inside joints, the cortisone wears down the cartilage that we have left. It feels real good for a while, usually, sometimes a day, sometimes several months, but it's actually destroying the cartilage at the same time, and then you end up with a worse injury. So please, guys, stay away from the cortisone shots. I rarely do them. Well, cortisone, O-N-E, at the end of a medicine, like prednisone, those are steroids, yes. So, cortisone is one of them. And that's the one that most commonly is used by doctors to inject shoulders and knees and hips, and just shouldn't be done. In my book, it shouldn't be done. I'm not telling the whole world of doctors what they should be doing. But it doesn't make any sense to put something in there that is a Band-Aid and then ruins the area later. I talk about this on the show often. A woman came in who had 16 steroid shots, cortisone, in her right elbow. She was a tennis player. And then she'd go back and it would hurt again. Then she'd go back to the doctor, get another one, and she'd be okay for a while. Then it would hurt again. Then she'd go back, get another one. And that extensor tendon on the lateral epicondyle was so worn down when she came to see me, she could hardly lift up her hand, extend her hand backwards, her wrist. And that took a lot of work to rebuild that tendon. We had to do a lot of we call it regenerative medicine now, using platelets from the blood or platelets and stem cells to heal the area. So she did well. It took her a while, and she got better. But sometimes there's just nothing I can do if the joint is so worn down or the tendon is worn off from getting these cortisone shots. So, Sally, God bless you, and thank you so much.
Go early to Dr. Darrow.
Thank you.
Thank you, Sally.
What a sweetheart.
Absolutely.
Yeah.
Well, you can talk to Dr. Darrow and get your free book at 866-870-5752. You want to talk about the book for a minute?
Yeah. It's a book I'm actually holding in my hand right now if you're watching the video of this, which all my radio shows go on my website, which is www.lastemcells.com. So you can listen to radio shows there, and you can watch me doing these procedures. There's videos of me doing the procedures there. And there's just a lot of information that you can read and learn how to heal yourself. And you can teach your doctors how to do this stuff without surgery. Now, I was in training to be an orthopedic surgeon until I had that shoulder surgery by my professor that ruined my shoulder for a few years. And I still love the guy. I don't think he did anything wrong. It's just that that's what happens often with surgery. And I get so many patients that come in who have had failed surgeries that made them a lot worse. And it's not a thing against the surgeons, because I love the surgeons. That's the hardest work in medicine. It's grueling. It's very difficult for them. And when I was doing the surgeries in my training, there were days we'd be on our feet like 20 hours a day. It was exhausting. And there's a lot of side effects that happen. I unfortunately saw one woman die on the table during a surgery. I've had other people who have died from surgeries later. I had one patient who had a knee surgery, a knee replacement, which he actually didn't need. And he died 2 weeks later from a blood clot that went to his brain. So we have to, it doesn't happen often, but if you're the guy it happens to, that's 100%. So there are a lot of failed surgeries. The insurance companies have a diagnostic code for like failed back surgery. That means it happens frequently. I would say in my experience, probably 50% of the time, these surgeries fail. So if you're like a gambler and you like to go to Las Vegas and you like that thrill, then get a surgery. I don't like that. So I learned how to do regenerative medicine. Today it's using platelets from your blood. It's real simple. You just draw the blood, spin it in a centrifuge, and inject it. And you can add stem cells to that. We do bone marrow. We just put a needle into the pelvis and the back above the buttocks and draw out the bone marrow. And bone marrow has platelets and stem cells and a lot of healing factors in it. So it's a real good way to heal quick. So I'm going to go to Gavin in 1 second, but I want to give out our phone number to get more callers. And the number to the studio right now where you can talk to me live is 866-870-5752. Grab your pens and pencils and write it down. I'm going to read it again, 866-870-5752. Now, if you catch, let's say you're shy. I hope you're not, because you can always pretend that you're your grandfather or something. And we'll be nice to you anyway. But don't be shy. Give us a call. But if you are shy, you can always just call my office, and that number is 800-300-9300. And there's people by the phones most of the time. If the phones are busy, just leave your name and they'll call you back and your phone number. And everybody that calls in now gets a free copy of my book, which is Stem Cell and Platelet Therapy. And then the byline's the most important part: regenerate, don't operate. Now, that's not for everything that happens. If you break a bone, you better go see the orthopedic surgeon. I'd say run to see him, but you can't run. But get there and get an opinion. I send a lot of my patients to orthopedic surgeons for second opinions. And there's a lot of guys I really like. One of them is Michael Gerhardt in Santa Monica at the Santa Monica Orthopedic Institute. SMOG, actually, it's called. And I like him because he's pretty conservative in terms he's not just going to do an operation because he gets a patient in the door. And so there are orthopedic surgeons that I do love, and some are conservative, but unfortunately most are, what should I call it? They have a hair trigger, and whatever walks in the door they're going to operate on. I think that's absolutely terrible. And but they do come from a culture that surgery is the best way to do things. And when I was in my training in orthopedic surgery, that's how I felt. That was the culture of it, and I thought only surgery could help. Anyway, let me go to Gavin. Gavin, you have 2 knees. I hope you do. Chronic pain. Can stem cells help? So give us a story. What happened to you, Gavin?
I'm sorry. Can you see? I'm having difficulty hearing you. I'm not certain if it's my phone.
Are you in the car?
Yes, sir, I am.
Why don't you pull over and get off your Bluetooth, and then we can hear you. But in the meantime, how long ago did your knees start hurting you?
My knees have started, well, first of all, I'm now 52 years old, and I have to admit I still play like I'm 30 years old. But I started having the points in my knee, probably in my right knee, about 8 years ago. Okay. And now my left knee is catching up, and what happens is there is a point in the range of motion where it's like it hits a nerve. Okay. And both knees literally buckle. It's worse when I'm extending my legs, where my quadriceps are flexing. When I'm passive, it's like walking downstairs, it's not as bad. But if you're walking upstairs and you hit that point, my knees will literally buckle because of a nerve reaction is all I can assume.
Okay. So let me give you a little bit of feedback. First of all, typically walking upstairs with knee pain is what we call a pathognomonic sign, meaning it's pretty assured this is what it is, that you may have patellofemoral syndrome, which means the joint between the patella and the femur and the tibia is worn down. And that's very common for guys who are super active. What sports have you done?
I have been a snow skier all of my life. So
I didn't catch that. Talk a little slower because you're in the car. You've been a what?
Okay. I have been an Olympic downhill skier, and I've been a snow skier my entire life, and I've raced motocross most of my life.
Okay. So, yeah, you're going to most likely have patellofemoral syndrome, which is maybe somewhat advanced. I don't know if your knees make noise. If you put your hand on a knee when you bend it, it'll feel what we call in medicine crepitus, or just a grinding. And that shows that that's what's going on. And yes, the platelets and the stem cells can help regrow the tissue, the cartilage in that joint, and help you feel a lot better. There's another sign if you ever go to a theater. I know people aren't going to theaters very much now. It's called the theater sign. Or when you're on an airplane, you're kind of cramped up and you can't move, or the knees will ache. That's another sign of this patellofemoral syndrome. But I would have to examine you, Gavin, and in about 2 seconds, I can tell you what's going on just by moving the knee around. And I have an ultrasound that I would look inside your knees to see what's happening also. The ultrasound I use is not a heat ultrasound for physical therapy. It's one that I can actually look inside the body and see what issue is happening. So I'm pretty sure that's what's going on with you, but again, I have to examine you to decide. Are you still pretty active?
I am. I will have to say I have used for the last 3 or 4 years PEMF, so that frequency does alleviate it, and I am actually able to move, but when I come off of it, the pain starts, and I have to admit I spent the last 2 weeks skiing, and it got so painful then that I actually had to stop because I couldn't continue.
Okay. Well, my experience is that PEMF feels good, but it doesn't do anything. That's just my experience. I had one of the first machines that came from Germany about 30 years ago. And I really used it a lot as an experiment to see if I wanted to use it on my patients, and it just didn't work long distance. So what I do, with regenerative medicine of putting your cells from your body back into that spot where the problem is, actually regrows the tissue and can heal it up. So I've seen MRIs and X-rays pre and post treatments, and you can actually see the cartilage growing. So it's something I've been doing, since the late 90s, and they tell me I do the most of anybody on the planet. I don't know if that's true or not, but I see amazing results. The reasons people fail with my treatment is they're overactive and they don't let it heal, or they're taking things like ibuprofen, non-steroidal anti-inflammatories that actually block the inflammation that's needed to heal. And by the way, inflammation is the body's natural way of healing. When you're inflamed, the body sequesters or draws fibroblasts to the area that grow back the tissue. And then one of the big failures is because people try it once or twice and they say it didn't work. It's working because we know it's growing tissue, because biopsies have been done to watch the process, but they haven't done enough for whatever their injury is. And another reason for failure is most doctors don't have an ultrasound to look inside. They don't want to learn how to do it, and they're expensive. I have 3 in my office, and we move them from room to room on a table. And then I'd say the last reason for failures are these clinics where mostly chiropractic clinics, I'd say, where they have, and this is nothing against chiropractors. Hang with me, please, because I want to finish this with you. We're going to the break, and give us a call at 866-870-5752, and I'll talk to you too.
All right, you're listening to Living Pain-Free with Dr. Marc Darrow. Grab a pen or a pencil, write down this important information coming your way, and we'll be right back.
You're listening to Living Pain-Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, Call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.